The Centers for Disease Control says 1 out of every 12 adults in South Florida is diagnosed with diabetes. That was in 2008. The latest data is available from the CDC, but public health workers say those numbers reflect a trend that diabetes is on the increase in our area and across the country. Dr. Carlos Ballestas of Boca Raton Regional Hospital joins us with more about this disease. First of all, doctor, thank you so much for joining us this midday. Let's talk about diabetes. And first, what is diabetes?
Diabetes is a metabolic disease that's characterized by an increase in sugar in the blood.
Sugar in the blood. And there are 2 types here. We hear about type 1, type 2. Let's distinguish between the 2.
Yeah, those are your 2 basic types. You've got type 1 diabetes, which is your patients that have that can't produce insulin. The body doesn't produce it, so they have that deficiency. Type 2 diabetes is characterized by the body can produce insulin, but the cells can't use that sugar. It can't get that sugar in the muscles and the tissue to use it.
Sure. And you know, there's symptoms you can see. There's things you can, and we'll talk about the things you can do to prevent getting one part of those diabetes, the type I should say.
Correct.
Symptoms of diabetes. Let's talk about those.
Your symptoms are classic. You've got several classic symptoms. You've got increase in thirst, increase in hunger, increase in urination, and fatigue. Those would be combined as your 4 classic symptoms. There's a lot of other symptoms, but those are your basic 4.
What can lead to someone contracting that type 2 diabetes?
Type 2 diabetes, there's 2 big components. There's a genetic component, a family history of diabetes, and there's also lifestyle factors that play a big role in it. When I say lifestyle factors, I mean what you eat, your weight, how you exercise, how you take care of yourself.
Is there a common advice that you give your patients, or if they're at the hospital, that this is what you need to do to stave off that type of diabetes?
Correct. I pretty much tell everybody the same. Watch what you eat. You don't have to necessarily be completely stringent on your diet or go to extremes. Just be careful with what you eat. Keep tabs on it. Exercise on a regular basis. And just keep an eye out for it. If you just watch those 2 things, you'll keep a lot of the diabetes. Or if you, for instance, develop diabetes from a genetic point of view, you can control it easier.
And then there's new ways of controlling it. As you know, it's easier and easier these days, correct?
Correct. They're always coming out with new medications, new different things. We're discovering more and more about diabetes every day just because there's so many people with it, that there's newer developments, newer medications, newer strategies for it all the time. Watch
that diet, keep a physical regimen of activities. Boy, that's the common advice we could give for so many ailments, correct?
Correct, yes.
All right. Doctor, thank you so much for joining us this midday. And Boca Raton Regional Hospital sponsors our expert and underwrites our Ask the Doctor feature.